Hello friends, Happy New Year. I have been receiving numerous comments through comment section of my YouTube videos as well as through emails as well as through WhatsApp messages regarding one question. The question is, sir, currently I am working as a outpatient coder. Now I want to become inpatient coder. So tell me how to become inpatient coder. As nowadays companies are providing more salary to inpatient coders as well as companies are providing work from home opportunities for inpatient coders, most of the outpatient coders are looking to enter into inpatient coding. After watching, if you like this session, please click on like button in order to vote me to provide more valuable videos. So today our topic is step by step process to become inpatient coder from outpatient coder in new year. So the agenda for this session is we will let first outpatient coder, inpatient coder, pros and cons of outpatient and inpatient coding. If anyone looking for free AAPC local chapter webinar links for free CUs, medical coding jobs in India, USA, UAE, join in our WhatsApp group. Group link is in the description of this video. First, we will learn few differences between outpatient coding as well as inpatient coding. Then I will tell you how to become inpatient coder. So in outpatient, as all of us know, APC CPC certification is the medical coding industry standard certification. In inpatient coding, AHIMA will provide the inpatient certifications where we are having two certifications, CCS and CCSA. CCS is for experienced inpatient coders, whereas CCA is for entry level coders. And also APC will provide inpatient coding certification, which is CIC. Common outpatient facilities include primary care offices, clinics, urgent care centers, as well as emergency department, where usually we will code using ICD-10, CM as well as CPT as well as HCPCS. Most common inpatient facilities are acute care hospital, rehabilitation centers, psychiatric hospitals, addiction treatment centers, as well as nursing homes. Most of the time in inpatient coding, we will use ICD-10 CM as well as ICD-10 PCS. In outpatient coding, the patient's main reason for the admission, which is confirmed by the physician after the evaluation, we will call it as first listed or primary diagnosis. Whereas in inpatient coding, we will call it as principal diagnosis, which is the diagnosis provided by the physician after the complete evaluation of the patient. In outpatient coding, we will not use uncertain terms such as probable, suspected, likely, questionable, and other similar terms. In inpatient coding, we can use probable, suspected, likely, questionable, and other similar terms if the physician mentions the condition as probable or suspected, we will code it as confirmed condition. As we have discussed previously, in outpatient coding, we will use ICD-10-CM, CPT as well as HCPCS, whereas in inpatient coding, we will use ICD-10-CM as well as ICD-10-PCS. In outpatient coding, most of the time, reimbursement is primarily based on physician fee schedules, insurance contractor rates, ambulatory surgery center rates, whereas in inpatient coding, it will depend on DRGs. In outpatient coding, there is no hospital stay, whereas in inpatient coding, minimum patient needs to stay 2 days. In outpatient coding, code assignment is based on the encounter or visit. In inpatient coding, code assignment is based on the length of stay. Usually we will call it as LOS. In outpatient coding, we will use CMS 1500 form, whereas in inpatient coding, we will use UB04 form. Now we will learn most common topics you need to know in order to become inpatient coder. So if you want to become inpatient coder, you need to have good understanding of reimbursement methodologies. In inpatient coding, you are having the concept IPPS, which usually we will call it as inpatient prospective payment system. Under this system, we are having DRGs. The other name for DRGs is diagnosis related groups. And we are having two types of DRGs, MSDRG as well as APR DRGs. If you want to become inpatient coder, you need to have good understanding of all these DRGs. You need to master MSDRGs, you need to master APR DRGs, as well as you need to master CC and HCC or CC and MCC condition, where CC means comorbid conditions, MCC means major comorbid conditions. Based on this condition, DRG will change. As we have discussed previously in inpatient coding, reimbursement is completely depends on DRGs. So if you code or select inappropriate CCs and MCCs, it will defect effects on the DRG assignment. And also you need to have good understanding of POAs. Usually we will call it as POA indicators. And also you need to master HCS. Usually we will call it as hospital acquired conditions. If you know all these topics, no need to worry. Directly you can try for inpatient coders. If you don't know all topics, please click on comment section and write what are the topics you want to learn on my channel. And also you need to master ICD-10 CM, where in live coding you need to use ICD-10 CM coding clinics in order to master ICD-10 CM code assignments. And also you need to master ICD-10 PCS, where we will use ICD-10 PCS for procedure coding in inpatient setting. If you want to learn inpatient coding, you will get free ICD-10 CM software as well as ICD-10 PCS software. Already I have provided that video in our FastCoder 21 YouTube channel. If you want more videos related to the inpatient coding software, please mention in the comment section of this video. Thanks for visiting our channel. If anyone looking for same-day surgery coding training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button in order to motivate me. And also if you are having any confusion or doubt, please mention in the comment section. As well as if you are visiting for the first time, please click on subscribe button. And also please share my channel to other coders who are looking to learn medical coding.